So y'all have seen the other two techniques. All right, here's what's important to remember is that the IM technique is different than all the others because we're trying to get the medicine deeper into the body. We're trying to bypass, and go straight through the dermal layer, the subcutaneous layer, and deposit the medicine deep within the muscle. The reason for that would either be that the medication that's ordered is very irritating to the surrounding tissues, or it may be very thick, or it may be that it needs to be able to be absorbed in a quicker way. So there's reasons why things are ordered in the level, whether it be subcutaneous, dermal, or, so there's reasons for why it's here. But that, in and of itself, alters the technique that we use a little bit. So each technique, intradermal, subcutaneous, and IM, have their own special characteristics, and that's what we need to think about today. Okay? Now, in order to begin, first I need to verify everything, all the 7 rights or 8 rights. How many are there now? 8. You need to go through all of those things, look at your MAR, know about your medicine, verify everything that you need to verify. As we're drawing it up, go through those steps. But then hopefully you will have already gone and evaluated your patient, because you're going to need to know your patient's size. You're going to need to know, kind of how big they are, kind of what you're giving. Is it thick? Is it a thin medicine? Because that will help you get the appropriate gauge of needle. If it's a thick medicine, you're going to need a larger bore needle because it won't come through that tiny little needle bore. If it's a big patient, you're going to need a longer needle in order to ensure that you're getting past the subcutaneous tissue and truly getting to muscle tissue. Plus, you're going to need to look at them and see how they distribute their body fat, because people are built in different ways. So you can look at your chart and say, oh, this lady's 5'9" and she weighs 145 pounds. But what if she's like an apple? And she has little bitty skinny legs and a big tummy, big old arms, like that. Well, then I probably wouldn't pick deltoid. I'd probably pick a leg, because I could get to her muscle very easily. Or what if you go in there and she's little bitty and she's big rump, big legs. This may be deltoid site would be best so that you can ensure muscle. Okay? Likewise, if she's thin, what if she's really little older patient or a pediatric patient? You need to be able to see where she distributes and where she's got some meat. Her muscles may have atrophied so that you're going to have trouble finding a muscular sort of portion on her. So, you just need to know your patient well enough to know what site would actually be the most appropriate. And you're going to have to do that by truly assessing, feeling, looking, and all of that. So you have the purview within your nursing judgment to determine what is the best gauge and what is the best length of needle that you should choose. Okay, so the range for IM is 20 gauge to 25 gauge, and the length is actually anywhere from, say, 5/8 to a half, those for pediatric patients or really elderly patients, all the way up to maybe even a 3-inch needle. Now, I will tell you, a 3-inch needle is long, and so, you have to really know, if I'm going to choose a 3-inch needle, I may need to go up on my gauge just slightly, because if this is a really large patient, otherwise it will be so flimsy that it'll bend. So you got to know what kind of medication, so all of these things come with time and experience as you gauge medicines versus size of patient. Does that make sense? That's why we give you a range of choices versus just one, because one size does not fit all. You got to look at the size of your patient and gauge that. All right, so we've done those things. We've done the appropriate identifying steps. We've done the appropriate assessment steps on our patient to know what's the best thing for them. Now, we're ready to go. So we've done the medicine room. We've drawn up our... Is that something in it? No, that's not. I really have glasses, but sometimes it's still can't see it. Okay. We're going to draw up. We verified everything. We're going to draw up our mill. We've gone in these vials so many times I don't have to inject air anymore for it to flow well, because they've been depressurized so long. Okay, so I'm going to draw up a mill. That's what my order says. So we're going to be ready. I've done all my verification. We're ready to go. Now, on this patient, I've decided this is a deltoid. Let's just say, okay? My non-dominant hand is my left. And when you go in this step for IM, it requires that you displace the skin over the injection site, simply because you move it out of the way, then you puncture and put the medicine down into the muscle. You make sure that it's not in a vessel by the aspiration step, which I'm going to show you what that is. You withdraw, and then when you let go of that skin, you're displacing it temporarily while you inject, and then you let it go. That skin's going to slide back over that injection site, and instead of having one direct puncture site down into the muscle where the medicine could go straight back out of that puncture site, kind of like a volcano does, it's going to have to find its way up, and then over, and then up and out. So it's very unlikely that medication will try to find that path of resistance. It's going to just stay right down in here. Now, if it had a straight blood shot back out, it'll just seep right back out of that puncture hole. So that's why we're creating that Z by displacing temporarily the tissue while we inject. Does that make sense? So if you'll picture that puncture site being like a Z, that's why it's named Z-track. Okay? So the purpose is to displace so that the medicine stays in the muscle where you intend for it to stay, so it won't irritate the subcutaneous and dermal tissues by seeping up. Okay? So this is my deltoid. I've identified my medication. We're ready to go. Got my gloves on. We're at a... Will somebody grab me a alcohol pad from over there? I need one to clean. There we go. Just grab me several, because you guys are going to practice up here in just a sec. And I've got plenty. I'll go get us some replacements. There you go. Thank you. All righty. Alcohol pad, just tear straight down the middle, and it's ready for you to grab. Okay, ready to go. Found my site, chromium process, couple of fingers down. Now I'm going to take my non-dominant hand using the heel of my non-dominant hand, leaving my fingers free to help me, because this is my helper hand. Clean my site. Just kind of stick that there because I'm going to need it later. Grab my syringe. If I have a table close by, I will take my cap and then I will place it back down on my table just to get it out of my way. Okay, so I'm still displaced. I'm going to turn my bevel toward me, because when you're saying the rule is always bevel up, well, I don't know what up is on 90 degrees. Is it toward me or is it away from me? I don't know. So I always turn my bevel toward me because you just want it to be point down. And this is a 90-degree technique. So you're going to go in like a dart, 90 degrees into the skin. Use your wrist to dart in. Don't be afraid and don't hesitate, because the worst thing you can do is go and push, 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 push. You want to slide in. These needles are meant to pierce the tissue, and they're meant to silicone coated so they'll slide through the tissue easily. But you got to give it enough force by dart technique to get in. Okay? So dart in. Then I'm going to reach up with my pincher fingers up high enough that I can see down here. Now this is aspiration. You're going to reach up and you're going to pull back on your plunger. Did you see those bubbles bubbling up? That lets me know that there's and that's air coming from the tissue itself. So it's not harmful to the patient at all. There's no pink or red swirling up in my medicine to let me know I'm in a capillary or vessel. So you're clear to inject at that point.
How far up do you need to pull it to aspirate?
Just enough that you can see a bubble.
And you never push... Oh, sorry.
Go ahead.
You never push the needle all the way in the...
You can. If I were to have been a little more aggressive, I would have buried it all the way to the hub. There is no need to do that, however, if I had picked the right length of needle. It's okay that I have a little needle left out. Now, it's also okay to go into the hub. Let's say this was a very large patient, and I knew that I had plenty of extra needle to go. You know, I would just gauge how hard that I did that based on whatever. So the proper length of needle is very important, because you don't want to have to get it buried up to the hub in order to get to the muscle. You'd want to choose a ½ inch longer needle to give you that latitude of not having that much in. Okay? So now we're good. I've aspirated. We're good to go. Nothing's in there. Now I'm going to reach right here and use your fingers to use the barrel to offset the pressure, and just you can hold the whole time with your pincher fingers, or you can choose not to, because I've got a stable hold with this hand. Slow and easy, inject my medicine, including the air that came out of the tissue. Okay? Now this hand is now folded out of my way. I'm going to come straight out the same angle I came in, and then you're just going to let go. The book says when you're in this position, though, after you've aspirated and you're in the patient, to wait 10 seconds. Now, the reason they say that is you're trying to wait and give that medicine time to displace in the tissues so that you're not pulling out so fast that it's going to try to force its way. The pressure's going to force its way back out. So I usually stand there for a minute or two, not a minute, second or two, and okay, Mr. Jones, just about done. Everything's fine. And say a few words to the patient, and then I come on out with my needle. Okay, but I want you to get that hand out of the way so that you're not going to poke I don't want you to stick yourself, because now you have a dirty needle, a contaminated needle, and it's really important that you look not only for your patient's safety, but your safety as well. So you come on out, and then let go. And it's not imperative that you immediately put the alcohol pad back on your patient and clean it off. It's really not. So take your time to be safe and scoop recap the needle. The other thing is you'll probably be using a safety needle, so you won't have to scoop recap, but you will have to engage the safety, which, it's a cap that lays over like this, and you'll just have to pop it up over your needle, and then you're safe. And then make sure that, okay, he's all cleaned up, Mr. Jones, everything's great, are you all right? Do you need anything? I'm going to cover you back up. Okay? So just make sure that you get your cap back on your needle or your safety engaged on your needle. But the important points are displace first, because you're going to otherwise rake right over your clean side. If you clean and then displace, you clean and then your hand goes right over the place you just clean. So clean, okay? Put your thing over here. Make sure you have your pincher fingers ready to help. Get that out of my way. Now I'm going in. Oop. I'm going to hold. I'm going to aspirate. Make sure I'm not in a vessel. Smooth and steady in. Let go. Hands out of the way. Smooth straight up and out. And all you got to do is hands off the patient. Let go. And then get your needle to be safe so that you can't hurt yourself or anybody. Whoa, balancing act. Okay. And then you're ready to go. Okay? Any questions about that part?
Can you feel when you're in the muscle to know, like, for instance, if it's a larger patient, you want to make sure that you are deep enough? Can you feel a resistance difference?
Not that much.
Okay.
Sadly, no. That's why you got to just. That's right. You've got to visually just gauge. And I'll tell you, putting your hands on the site, sort of pinching around and moving around on the tissue tells you a lot.
Okay.
And so then you've just got to overshoot your length. So in other words, if I think, oh, that's about 2 inches or that's about 1.5 inches, I'm going to probably go 1/2 inch up higher than what I need, because I know that if I don't get a complete, I have to use the whole length of the needle to hope I get there. So I'll choose a little bit longer than what I need. And likewise, the smallest one is like 1/2 inch. Like if you've got a little 80-year-old woman and she weighs 75 pounds and she's just all, atrophied and all, I would probably use no more than 1/2, and I'd search around to see where's the meatiest, muscliest feeling, because, a lot of times muscles atrophy so much in old age. Little babies and little kids, pediatric, they're little and they may be skinny, but their little vastus will just pop right up for you. You can feel it super easy. There's very little subcutaneous tissue over it, so you can feel it very well. Legs on kids is usually the best way to go. And you'll learn that when you're in a pediatric site. But little old people, they just may be all dried up, and it's hard to find a place. So you just kind of have to you think, you know what I'm talking about. So you just have to see what's best. And ventrogluteal, sure, a little hiney, there may not be a thing. So you just have to feel what's best on each patient that you assess. Okay? Questions about this before I let you go, because I want you to spread out, and we're going to go practice at each of these stations, okay?
Can you put it on any part of the body that has muscle?
Well, now, what are your 3 IM sites?
The deltoid.
The deltoid,
the
ventrogluteal. That's it. So, of these 3 places, well, that's not really, I was sort of in general. I was just poking at something. But, here, here, and here really are your own places. But you got 6 of those, if they've got another side. Hey, some patients don't, you may not be, you may be missing an arm or a leg. But you got 6 sites to choose from, okay?
What I do is that sometimes...
All right, let's go practice. 2 of you.